First off, let me say thank you for being willing to reschedule. I had an unexpected event yesterday, so I appreciate the flexibility and shifting to today. Glad you're able to join us. This is very open and informal, so if you have any questions along the way, please feel free to put them in the chat or unmute and ask your questions as we go through things. So I'm Dr. Michael DePalma. I'm the program director for the Master of Biomedical Science program. I've been a PA for over 22, 23 years. This is kind of my third career. I was in the Navy initially, and I was a microbiologist for 8 years before I decided that I wanted to pursue more interest in medicine. So I went back as a non-traditional student. So I kind of like to introduce that because a lot of students that are coming to us are looking for an alternative pathway. Either you've been in another career or you've been trying to get into another program. And I think this, what we've tried to put together here is a nice pathway to bridge from your undergraduate year, from your prior studies into another profession that you may be interested in. So Sarah Amini Rodhall is our program manager. She's also here. You probably received some emails from her. You are more than welcome to reach out to either of us after or during the presentation if you have any additional questions. Another name that you might have already, if you've been on our website at all, familiar with is Joe Kopelman. He's the enrollment counselor in our online admissions office. And you might get some emails from him occasionally. So I like to mention his name because he reaches out quite a bit along with Sarah. Okay, so let's get started. If anybody else joins, we'll be happy to repeat anything that we need to. A little bit about AT-STIL University. It's a nationwide school with campuses in Arizona, Missouri, and California, but really with over distance sites in over 100 different locations around the country. Our focus today is on the Arizona School of Health Sciences online Masters of Biomedical Science program. But as you can see, they offer programs in multiple healthcare disciplines. This kind of goes into the mission of the university, which I like to start off with as well, because their mission is to prepare highly competent professionals really in that whole person healthcare. And I mention that because that's what the programs look for in applicants. We want a whole well-rounded applicant applying to not only our program, but to the programs that you're hoping to get into, with maybe some focus in underserved population, underrepresented communities, and that really helps to fulfill the mission of the university. I really mentioned that early, and we're going to revisit that later in the presentation because we want this program and any future program to kind of align with your mission too. So keep those underlying words in the back of your mind as we talk about things and go through and we'll revisit them again. So a little bit about the program. It's completely online, 100% asynchronous, which does align pretty well with those students who would like to try and work. It is a rather challenging program in that we do 45 credit hours in those 9 months. It was designed that way to front load and for you to be able to demonstrate. And right now we're kind of focusing on the PA aspect. As we get through this talk, we'll see that we're also developing a dental concentration. So as you look at your application, if your GPA is in need of a little rehab, if it's been a while since you've taken some of this coursework, if you've applied to programs in the past, and the feedback that you've gotten is you need to strengthen some coursework just so we have some confidence in what kind of student that you would be in the next professional school. That's where this program came about. So we're very focused on developing and refining and taking those advanced sciences to the next step that you'll face when you get into those schools. So it's really for performance and success in applying and getting your application to look better, both in PA and dental school, as well as how well you'll do once you get into that next stage and succeed. So the next few slides, I'm going to focus more on PA school. That's what we developed our program into, and that's what we've had some documented success for. And as I mentioned, we're exploring the partnership with our dental programs to help provide a pathway into that. So I think you can kind of extrapolate similar comparisons with the two programs. They're very competitive. 318 PA programs in the country, which are still projected to rise in the next few years. The entry points, I kind of mentioned that because our program starts in July. It'll end in May at this point. We're exploring another entry point in January, which kind of would align with some of those programs, at least in the PA program, that would align with the January cohorts. But as far as competition, and again, equally in the dental program, 33,000 applicants in the most recent cycle, only 12,000 matriculated, 12,600 matriculated. So, you're looking at just under a 40% acceptance rate. So what's happening to those other 60%? That's competition for slots. It's competition for good qualified students. And you might be in a good position to present yourself that way, but the school, the interviewers want to know that coming into it. So they want some good hard evidence to say, yeah, we're willing to say that, you're capable of doing this. And that's why we kind of developed this program for you to be able to demonstrate that. Some graphs to kind of show the trends of PA school applications over the last several years have continued to go up as well as the PA programs do. But you'll notice that the number of applicants are outpacing the number of acceptance. So if you kind of graph this out, the number of applications is increasing by an average of over 1,000 a year, and the number of acceptance is increasing by just under 700 or 750 a year. So the number of applications continues to rise. The number of acceptance is rising, but not as rapidly. Again, just equaling more competition. So the questions, at least from PA standpoint, is applicants are applying roughly 2 years and before they're getting accepted. The application rate for acceptance rates continues to increase, but has been flattening out. And then more importantly, once you get into PA school, what we're trying to focus on is your performance and how you do. And the graduation rate is around 94%. Academic dismissal rate has gone down a little bit, which is good. But I think when you look at what's driving that, it's because the programs are selecting more qualified candidates who are better prepared. The bigger number that's been going up is something we call deceleration. Deceleration can be both short or long term. So a deceleration in academic terms means you have to repeat a course, short-term deceleration, or you actually have to come back and repeat an entire year, which is long-term deceleration. That costs the universities money, so they kind of want to try and make sure that you're better prepared so you don't have academic struggles, but it also costs you a lot of money because you have to repeat that entire year over again. So by taking this program to prepare yourself, you can hopefully reduce that risk of needing to repeat anything. So the big question, and again, applying to both applicant pools, is how can I be a more competitive applicant? Those top few bullets will kind of is where our program can help. The bottom few I like to still talk about in general terms. I used to sit on an admissions committee for a PA program, and I answered and fielded a lot of these questions of students that came in. So areas of weakness, obviously GPA tends to be a big one that we focus on and students focus on. Having 45 total credits can help boost your GPA. 28 of those credits are in advanced sciences, so it can really help boost your science GPA as well. Demonstration of a record of academic success. And the phrase that I like to use over and over again is sustained academic success. It's great when you go out and you take a repeat course, or you take pharmacology, or you take anatomy at a local community college, but you're taking one class in a summertime. Not that it's not difficult if you're working full time, but it's one class. And what admissions committees like to see is that you have a record of sustained academic success. So we really front load our curriculum to show that you're able to handle multiple courses of difference and varying degrees of difficulty at the same time, and you can demonstrate that early in the program. Our application, or our capstone series, also helps to refine your applications in terms of the personal statement. We offer mock interviews, at least an opportunity to meet and go through an interview process. So that helps to alleviate some of the anxiety that you may have, or it just helps to better prepare you when you get to those. So those top areas are how our program can help. The other areas that really admissions committees look for is healthcare experience, quality healthcare experience. I really should put the term quality healthcare experience at the beginning of that, because we have a lot of applicants who have been scribes. Scribing is really, it's unique to the program that you're applying to. So I would really reach out to their admissions committee and say, does this count as quality contact, patient contact? Scribing is great. You learn medical terminology. You learn how the medical systems work and how we interact with patients, but you're not actually doing your own interacting. So something like a CNA, a dental hygienist, some capacity where you're interacting personally with the patient is what a lot of programs consider to be quality healthcare experience. So don't just take my word for it. Reach out to those individual programs and say, what do you consider my scribe quality healthcare, or will it count toward this? Volunteer hours too, volunteer versus paid. A lot of applications break down if you're volunteering, what type of face-to-face interaction do you have with volunteering? You know, sitting at a desk and taking registrations versus are you actually volunteering where you're taking blood pressures or something along those lines. So it really comes into quality kind of experience. Mission-oriented activities, as I mentioned, AT-Still University is very focused on helping the underserved community. So if you've been on mission trips, if you've had the opportunity to participate in any community activities, really emphasize that on your applications, because admissions committees and counselors really want to see that in what you've done. Some programs that are heavy into research would like to see if you've done research as an undergrad, postgraduate, in any kind of work. So, you know, really focus on those areas, as well as teaching. That can go a long way too if you've had any TA opportunities or you've taught, can take your application to another step that other applicants may not have had that similar. The bottom line is ask. If you've gone through an interview, you haven't been successful at getting an offer to the program, reach out and ask, what can I do to improve my application? You know, to make me more competitive next year. One of the big things that I saw as an interviewer is when students would come back the next year, one of the biggest questions, and I guarantee everybody's going to ask this if you applied, if you're a repeat applicant, what have you done since last year? What have you done to improve your application? Taking a program, whether you take this program or not, if you've done coursework, you know, you've gotten extra hours in healthcare, any of those things are going to take your application to the next step to show that you've not just applied from last year, that you've done something more, because that's what they want to see. Why didn't you get in last year? What have you done to improve yourself next year? So ask and take that to the next level. Okay, so back to our program and a little bit more. I keep mentioning that, you know, gives you the ability, completing our program gives you the ability to demonstrate your academic value, you know, your academic worth. This is what I'm capable of doing. There are a lot of programs out there that have minimum GPA requirements. But there are a lot of programs out there that don't, and they look at either the most recent coursework. Look, I stumbled as an undergraduate. I was working full time. I wasn't sure what I wanted to do in life. We all face those struggles. But now I really researched this profession. This is what I want to do. This is what I want to be. This is why I've taken these steps. I've taken this coursework to try and advance myself. This is what I'm doing to improve my academic ability. This is why it's worth taking a chance on me. That's what they want to hear. I mentioned our coursework. I'll go through the courses in a few slides here so you can see exactly what we do. But that rigorous pace that we offer these courses in, you're taking 15 credits in your first block, 13 credits in your second block. So you're doing essentially 10 classes in the first semester from July to December. That's a very fast pace, but that mimics what you can expect in PA or dental school. This fast pace, a lot of information, a lot of courses going on at the same time. Not unusual to have 2, 3, 4 exams in a week on different subjects. It's not unusual to have a paper or a project or a presentation or a clinical or a practical exam, something along those lines at the same time. So this helps you to really work on time management and balancing your studies. The online asynchronous format, we offer our courses, the blocks open on Mondays. They end on Sundays. So that gives you the entire week to say, okay, I'm going to lay out my schedule. This is how I'm going to do things. Our faculty are always willing to meet. We have posted office hours. Many of us are by appointment so that you can meet with your faculty. But that asynchronous allows you to work at your pace and at your free time. So I keep promising the curriculum. Here's what we offer. If you're in the PA concentration, you would take general anatomy. If once we have it all developed, it's currently under development now in the dental concentration, then you'll be taking head and neck anatomy. All the other courses are very common and mixed as far as covering physiology. We have 3 courses in physiology that really get in depth of organ systems. Biochemistry, an essential building block for pharmacology. 2 classes in pharmacology, microbiology and infectious diseases. We take this to the human disease standpoint, and we really take what you've learned in undergraduate to the next level. Same thing with immunology and genetics. We also offer a few courses in social sciences, which are very important. Medical writing, really it's for communication purposes. We're not looking to turn you into publishing authors, but it's really important to understand how to interpret and read guidelines and medical literature that's out there. That's how we practice evidence-based medicine. Medical ethics and social behavioral determinants of health are 2 very important courses because you'll learn a lot of those when you get to PA or dental school. But you're trying to learn medicine at the same time you're trying to learn the population that you're treating. Defining that before you get to that point is so helpful, because then as you're learning the medicine, you could really understand the populations that you're trying to treat. And that's really, depending if you're in rural healthcare or if you're in the middle of an inner city population, you really need to understand where your patients will be coming from all backgrounds, demographics, socioeconomic status, because it really helps you to provide better care. Our capstone series is built into 3 courses. Our first capstone focuses on team-based healthcare. So you learn all the components and members of the team and how we all work together to provide care. In capstone 2, that's when you get into a little bit more of the discipline specific. You get to interview either a PA or a dentist. You get to talk more about the specifics and where our mock interviews, where our personal statement come into play. And then we tie it into social behavioral determinants, because between capstone 2 and capstone 3, you actually develop a community project of how you can see either a PA or a dentist kind of helping the community in oral health or in general health to influence the community and how we can interact with that. So we do a written project and a video demonstration in your capstone 3. How our calendar is slated is our next cohort will start in July of 2026. The application window is scheduled to open on November 1st. I mentioned our 10-week blocks. We start in July with July, well, it might be July 13th. So our fall blocks run 10 weeks for the fall block 1 and fall block 2. Then there's a week in between those. There's a few weeks in between fall block 2 and spring block 1. We start up again in January. There's a week off between spring block 1 and spring block 2. And then spring block 2 is only 4 weeks, or excuse me, 6 weeks. It's 4 credits, and it's only your capstone series kind of finishing off your major project. And rather than go the full 10 weeks, we wanted to finish in May, because a lot of programs that matriculate in the middle of May, it gives you an opportunity to get transitioned if you're going to start that soon. And then, of course, we have graduation in person in Mesa, Arizona on June 4th. And we do encourage students to attend. It is rather exciting to get hooded and celebrate your accomplishment. Our course calendar or schedule looks a little bit like this. This is on our website too, that you may have seen this. So medical writing, medical physiology 1, biochemistry, microbiology, and either head and neck anatomy or general anatomy are what you take in those first 10 weeks. That's a pretty rigorous amount of courses right there. And students that are going through that, it really, again, by design, because it's teaching you good early time management skills that are necessary in the next phase. But it's also demonstrating that you can handle this heavy course load. Similar course load in fall block 2, where you take medical ethics, medical physiology 2, pharmacology 1, genetics, and capstone 1. 5 courses, 13 credits. So by December, you will have 28 credits. If you're going through the application process during this time, you would at least have 28 credits to say, look, this is what I'm capable of, this is what I'm doing, and this is why we kind of set up this way. If your interview happens to be in the spring, you get through the spring, you get an extra 13 credits there. That way you can really prove that you're capable of doing it early. So course structure, how do we run these online courses? Well, the assignments are made up of weekly discussion posts, assignments. Quizzes can be either weekly, sometimes they're modular. If a module can sometimes be 2, 3 weeks, and there'll be an end of module quiz. Sometimes we have a midterm and an end of block quiz. So it really depends on the course that you're taking. Assignments are both in written and video form. It's very important to start to begin to get comfortable with presenting yourself and being on camera, or at least in communicating with other students, because that's how you'll be communicating to patients. Um, Discussion posts and classmate responses, they're very important because this is how we interact. Even though it's asynchronous, our students have actually, the feedback we've gotten on our surveys, and even in having discussions with them, is they really enjoy conversing with their classmates and their peers, because they come from a lot of different demographics and backgrounds, and you really learn a lot from your peers who might live in a different community than you do, who might bring a different perspective than you do, who might be from undergraduate and you've been out of school for a few years working, and they're learning from your life experiences. So it really brings together a good demographic. I'm going to jump down to office hours since we're kind of talking about that. Office hours are virtual, and they really vary by class. I teach micro. I like to have posted office hours. They're sometimes days, evenings, and it's not convenient for everybody. So I'll have students that will reach out to me and say, "Can you meet during this time?" Yes, absolutely. And that's what a lot of other instructors do, because they are still working full time, either as faculty in programs or clinically, and they have full-time jobs during the day, so they will offer to meet in the evenings when they have time, but by office hours. I mean, by appointment. On-time submission, we've really kind of stepped this part of the program up a little bit, in that we're very strict about turning in required assignments on time. This is how you develop those good time management skills. If you can develop this early, you will be successful in the program. If you struggle with on-time submissions, you're going to continue to struggle as you get to the next phase, and that's going to be very difficult for you to play catch up with. So we really kind of um, really adhere to a tight on-time submission schedule. We certainly understand life happens. This is where communication with your instructors is very important, and this is professionalism, developing those good skills. Reach out. I understand I'm late with this. I'm taking responsibility for this. This is what's going on. I will get this to you as soon as I can. Yes, you lose points, but you're being professional, and this is what we expect of our students, and this is what's expected when you get to the next level of your training. Again, just a quick rundown of our course schedule and why this is all laid out this way is, 28 credits in those first two blocks. Sustained academic ability. This is really how, what you should enforce on your interviews, and your ability to demonstrate this. So similar course load to that you would expect in both PA and dental school is why we've kind of front loaded this. Very proud of the faculty that we've assembled. Right now we have most of our faculty, they're not all PAs, so we have a lot of instructors who are subject matter experts in biochemistry, in anatomy, in physiology, and pharmacology. Our instructor in medical ethics has a master's of jurisprudence in health law. So we take a lot of pride in the fact that we have a very diverse group of faculty that will be instructing you. And they all have experience now with online and asynchronous instruction. So they're very, very comfortable and very used to this. So who should apply? Hopefully you have a good grasp on this as we get to this point. If your overall or science GPAs need a little bit of improvement, if it's been a while since you've had some of those upper level science courses, or if you've just had basic science courses and you need to take them to the upper level, this is where we'll have a little bit more challenging. You'll hear the term gap or bridge year applied to programs like this. We don't like to use a gap year because that means you're taking a year off. But if you're coming from undergraduate, or if you're transitioning and you're looking to strengthen yourself, that bridge to the next step, this is where the program can come into play. We have very few prerequisites because we really wanted to try and turn this into an opportunity for students to succeed, or at least show their ability to succeed. Anatomy is a requirement for both programs, both dental track and PA track. So we require anatomy, a 3-credit anatomy course It should be human anatomy, or at least vertebrate anatomy. Um, English composition, we do require English composition 2 classes because we do a lot of writing in our program. So foundational writing is very important to have a good grasp so that you can succeed. Online programs, that's how we communicate through discussion-based and written assignments. So it is very important to have a good grasp of grammar. GPA of 2.5. So roughly, if you, depending on how many credits you've taken, this is a very rough calculation, and I encourage everybody to do their own individual calculations. But based on the fact that you have 28 science credits and 45 overall credits, if you would have roughly a 2.75 GPA, and you have the average number of credits around 60 science and 130 general, if you got a 3.6, I think it's 3.61 in the MSBSM program, that would elevate your overall GPA and your science GPA up to about a 3.0, which is the minimum that a lot of programs look for. This doesn't mean you have to have a 2.75 coming into it. As I mentioned, we have our starting GPA as a 2.5 because there are programs who want to see what you've done recently or what your recent academic ability is. So that's why we have a GPA of 2.5, and we encourage students to, come into our program and succeed and do well and show that they're capable of doing that. So the only other requirements that we have, 1 letter of recommendation and a personal statement. If you've applied to PA school through Casper, if you applied to dental school, you're more than welcome to upload 1 letter of recommendation that you've received from for those applications, and same thing with your personal statement. We just want to get an idea of who you are, why you're interested in this field, and what you've done to get there. So coming back to that mission statement that I talked about early on is, what's your mission? Ask yourself, what's your mission? When you're interviewing with these programs, you're interviewing them as well as they're interviewing you. This should be a right fit. Do their missions align with what your missions are? Does their academic, at least structure, do their programs, how they lay out their courses, how they teach you? Is it problem-based learning? Is it case-based learning? Is it modular-based learning? Those are all good questions to ask. Is how do you learn best? And is it going to align with how you learn best? If it doesn't, you're not setting yourself up for the maximum level of success, and you may struggle in those capacities. So really look at what the programs can do for you, and how you're basically set up to succeed. The guarantee interview, if you've been on our website and you've noticed that they offer guaranteed interviews, this is an interview, this is not an automatic seat in the program, but the guaranteed interview applies if you achieve a 3.5 minimum GPA in the master's program, which means you have to complete the program to get the 3.5 GPA, and you meet the minimum prerequisite requirements of either program. So you have to meet the minimum program requirements. That means if they require a minimum 3.0, you have to have the minimum 3.0 as well. Then you will be granted the automatic interview with the programs. Financial aid is available. The only reason I put the slide up here is to have the contact information, because financial aid is very highly individualized. It's something that's very important. You should be worried about it as a student, particularly in the changing climates. Our financial counselors are well versed on this. They offer one-on-one meetings, and I think it's very important to set those up to figure out not only how you pay for this program, but how you pay for the next program if you would get into it. So, please reach out to them. 2 quick disclaimers. One I've already talked about with the automatic interview. It is just the interview. It's not an automatic seat in the programs. And the other is, our program right now is set up for prospective PA programs. As I mentioned, we're exploring adding in the dental concentration, at which point the mixed cohorts would apply to primarily the AT-STIL Arizona dental program. So because programs, both PA, dental, any other healthcare programs that you might be interested in, are very, very highly specialized, I'd just like to stress that it's your responsibility to reach out to make sure that prerequisite courses that we're offering would meet what their requirements are. I would hate for people to go through our program thinking that our courses meet recommendations or meet their prerequisite requirements, and find out that they don't. So just reach out to them early on and say, this is what I'm taking. Does this meet your requirements, and will this work for what you need? And that will help you and save you some time in the long run. Just some quick progress of our first cohort that we had graduate. Our second cohort just recently graduated in June. And our third cohort started in July. So we're tracking a lot of progress, but I want to show that, our entry point GPAs, our overall entry point coming in was below a 3.0. So we did accept a lot of students, even granted some waivers. You notice our minimum GPAs. And why did we do this? Because they were demonstrating to us that they've done some recent coursework and were capable of succeeding. So we granted waivers to let them into our program. And they actually did very, very well. Our final cumulative overall GPA was 3.67, and our science GPA was 3.63. So they were able to demonstrate that even though they had lower undergraduate GPAs, they were capable of doing the coursework and handling the load. All that aside, what does that mean for students who qualified for the interviews? Again, focusing on PA, because that was what the first cohorts initially was set out to do. We had 35 graduates in our first cohort. Of those 35 graduates, 28 of them had GPAs of 3.5 or higher. 27 of them met the prerequisite requirements of the ASHS, the Arizona School of Health Sciences PA program. So out of those 27, 15 of them applied to the program, completed the application, and applied to the program. So yes, out of 35 total graduates, we want to focus on those 15. Out of 15, 2 of them actually got accepted because they had met the prerequisite requirements and applied during the year, got accepted to the class of 2026. 10 of them actually got accepted to the class of 2027. So 12 out of those 15 were offered admission. So 12 out of 15, 80% of the ones that applied were offered admission from the overall class of 35 students. 34%, just over a third of the class, got into the Arizona School of Health Sciences PA program. We know that other students had gotten into other programs from surveys, but they were anonymous surveys, so we don't have that exact data to track. So in actuality, that 34% is much higher. From our current class, 3 students have already gotten into the class that just graduated in June of 2025. So 3 students got into that current year, and 2 more students actually got into other programs. So 5 out of that recent graduating class. There were 30 in that most recent graduating class. All right, so we're wrapping things up here. What's our goal? Our goal ultimately is to help you reach your goal. We want to see everybody wearing white coats at some point. So we want to make sure that you're well trained and well prepared to get into that next level. Here is some contact information for us. My email address, Sarah's email address, our program email address, and then Joe's through online inquiry at ATSU. If you have any questions at any point in time after this, I'm certainly going to open it up to any questions now, but if you have questions afterwards, please feel free to reach out to us. So, do we have any questions?
Dr. DePalma, so we do actually have some questions in
Great.
the chat. So how long after submitting the application do students typically hear back with the decision?
The decision for acceptance, that's a good question, because the application, once it's complete, and when I say once it's complete, we have to have all your transcripts, letters of recommendation, things like that. Then they get forwarded to the admissions reviewers. And once we review them, we make a decision and extend an offer usually within a few days. So if you have everything 100% complete as far as the transcripts, and I mentioned transcripts because that's usually what takes the longest to come in, then we make a pretty quick decision. Mm-hmm. A lot of students are applying and end up on a wait list for a program. And then they will say, well, if I've been offered an acceptance, how long can I wait? We do give a timeline for accepting our offer, but we don't necessarily say, if you're waiting, just keep us in the loop of when you want to hear. We understand that's your goal, is to get in. And if you're on a wait list, it's a nice backup program that we can have here. So we can offer admission and then kind of hold your admission if you're waiting on a wait list. Does that answer your question?
I think it does.
Okay.
Okay, so for the prerequisite GPA of 2.5, is that for cumulative or science?
It's for both 2.5 cumulative and overall and science GPA, but don't let that keep you from applying. As I mentioned, we do grant waivers. We're willing to look at all coursework. I think, we look at things in terms of what the next program will be able to offer you. And if your GPA is really too low that our program can't help with that, just keep in touch with us. We're always willing to have conversations about whether or not our program will benefit you at the next level. But we are always willing to look over applications as a whole and not just a GPA when it comes to granting waivers.
Okay. Are students encouraged to work part-time during the program, or is it considered too rigorous?
Um, I wish we had a student on here that could answer that question. I don't want to say you can't work because I understand you have to be able to pay for these things. It all depends on the type of student that you are. We tried to lay out the coursework so that you get your assignments on Monday. You know what's expected of you during the week. If you can balance your time, manage your time, you're going to set yourself up for success. We have students right now who are working full-time jobs, and a lot of them are saying it's taken some time, but they're able to do it. Other students are struggling a bit, and I think it's a little more than they expected. We have a lot of parents who are in our program too that are taking care of families as well as working. So it can be done, but it really is on the individual and the type of student you are. I will say, if anything, it does help you develop those time management skills earlier in the program, which again are essential. As someone who taught in PA school, I can tell you that the first month, 2 months, students just feel like they're underwater. We describe it as trying to drink from a water fountain, just because it's a lot of information coming at you in a short period of time. Trying to drink from a fire hydrant, not a water fountain. So I'm getting dry mouth, so I need a drink. That's why I was thinking of a water fountain. So learning those skills are just really instrumental as you start off and set yourself up for success early in that academic career. It's not a weed out period, so to speak, but they want to make sure that you're capable of handling all that work early in the program.
And then are there any research opportunities or shadowing experiences within the MSBMS program?
Yeah, good question. And we get that every year. Unfortunately, in 9 months, we just don't have the ability to fit research in there. I would love to, but it's really hard to do research in 9 months with everything else that's being juggled. We want you to research the profession and learn about the research and the evidence-based medicine that's out there. But we really can't offer too much research in an online and asynchronous format. Shadowing, yeah, we encourage you to reach out to interview either a PA or a dentist. And that's part of one of the assignments at Capstone too. We don't specifically do shadowing. That's very community and hospital or healthcare specific. And that's an area that you just have to, um, again, reach out to the programs and find out how important shadowing is. Most of them want to know that you know what that health profession does, and that you know what you're getting into. I think going through our program, being able to explain that would make up for some shadowing hours, but there are some programs out there that have very strict number of minimum hours that you have to shadow. So,
Thank you. At the moment, that's the last question in the chat.
okay.
Thank you. Yes, it was great.
Good. Thank you for joining us. Again, thank you for rescheduling for today, but please feel free to reach out at any time. And if you have questions, we will help you as best we can.
I do have another
Sure.
question. Now, I was kind of going over the curriculum, and I've
Mhm.
taken some of those courses that's on there. Would the grades that I have now kind of substitute, what we're required to take with the program, or would I have to retake them?
Yeah, unfortunately not, because part of the intent of our program is to be able to demonstrate that you're able to handle all the courses at the same time. They are, in a sense, designed clinically based. So if you had a medical micro course in undergraduate, say, it is good, it's great, it's going to definitely help you breeze through this course. But again, because I teach it, I know I really try and put the human spin or the infectious disease component to it and tie it up with doing case studies. So you're actually developing clinical skills, critical thinking skills, and the courses were designed in that way that were kind of really helping to transition you to the next step. So yeah, unfortunately, we can't substitute any of the other coursework that you might have had, but know that it will help transition you or get you through the program a little easier.
I got it.
Yeah, does that make sense?
Yes, it makes total
Yeah.
sense. That's all I have, yeah, for today.
Okay. Great. Thanks for joining us. Please feel free to, again, reach out if you have any questions.
Thank you so much. Have a good day.
Thank you. You too.
Bye-bye.
Thank you.